Hello everyone, this is Mousa. Today we'll talk about the relation between postoperative delirium and preoperative routine serum biomarkers. Delirium is an acute neurobehavioral syndrome. The patients develop disturbance in conscious level and cognitive function. It's associated with longer hospital stay and high mortality rate. Delirium is due to alternation in the neurotransmitter synthesis function and or availability. This alternation could be explained by some theories, for example, neuroinflammatory and oxidative stress. We aimed to assess the relationship between the incidence of postoperative delirium and the preoperative serum biomarkers like neutrophil lymphocyte ratio and platelet lymphocyte ratio. We aimed to see the correlation between NLR and routine preoperative laboratory investigation. We recruited patients aged 65 years or more who underwent emergency laparotomy surgery at Queen Elizabeth Hospital at Birmingham. Those patients were registered at National Emergency Laparotomy Audit Database. We did that both prospectively and retrospectively. We documented the preoperative blood results like complete blood counts and serum electrolyte. We documented the incidence and outcomes of postoperative delirium. In the prospective part, we explored the delirium 5 days postoperatively using 480, AMT10, MRAS, and CAM-ICU. In the retrospective part, the clinical notes were scanned for keywords according to validated chart abstraction method in the period from January 2018 to January 2019. Postoperative delirium was diagnosed against the DSM-5 criteria in both parts. As you can see, out of 115 patients, 30 patients developed postoperative delirium. This is quite significant as it's nearly 1/4 of patients. We found high NLR and PLR were significantly related to postoperative delirium. We found a significant positive correlation between NLR and preoperative white blood cells, neutrophil, PLR, and a significant negative correlation between NLR and lymphocytic counts. We found some predisposing factors like high PPOSM morbidity and mortality scores. High NELA mortality score are associated with postoperative delirium. Longer hospital stay, critical care admissions, and patients' mortality rate were significantly higher in postoperative delirium. We found low preoperative hemoglobin level and sepsis are independent risk factors. In conclusion, we found that high PLR and NLR values are associated with postoperative delirium development. The preoperative inflammatory status can link it to postoperative delirium. Neutrophil lymphocyte ratio, platelet lymphocyte ratio could be a good postoperative delirium predictor. Thank you very much, and any question, please.